throw on the headphones so you could
Hear myself. Okay.
dive into this world.
Was this planned?
Was what planned? No, that's been there. That's been there.
It's my godfather. No.
Yeah, all right.
I'm kidding. There's actually like stories about that man in terms of like
Trauma?
trauma.
Yeah, of course. Here, hold on. Let me.
Yeah.
So the mic is gonna.
Testing. Okay.
Go ahead, check it out.
I hear myself.
Yeah, you could hear
So
yourself.
weird.
Yeah, so you're gonna kind of sink into this world of, I don't know, just this thing that we call a podcast. Take a sip of water.
How did you get started?
I had thought about being on a podcast. During COVID, I went live a few times with just random people who asked me to be on to talk about COVID and whatever that was. And then I just decided, and then I went on the Miami Lit podcast.
Oh, okay.
And when I sat in there, I was like, this is so cool. And all we're doing is having a conversation.
Yeah.
And then it's content you're producing. And we're in a content-driven market.
Yeah.
It's a simple thing. The only part that's difficult is everything is post-processing. Because we could record this and have an amazing exchange. But then it's what do you do with that content? And so that's where I'm at. Right now, I'm kind of stacking content without putting it out. So I'm just building it. And then I have somebody who's going to come in. I'm just going to sit down, listen, write notes, write basically time marks like, hey, 3:37 to 3:43. And just crop a bunch of them, have them just piled up, and then just put them out little by little.
Yeah. Like 15-second videos.
Yeah. Because that's people's attention span right now.
Unfortunately.
Yeah.
15 to 30 seconds.
30 seconds is long.
Now it is.
Yeah.
Yeah.
Which is
now,
bizarre.
And now you don't even really need to listen to audio. I find myself editing video sometimes, just putting the captions. And even I myself, like I'm just scrolling in silence and I'm still getting the content of the video because it's transcribed.
This is just where we're at. And
Yeah.
so I'm adjusting as I go. And so that's how I got started. And so I decided to build this thing, this room. And here we are.
Yep.
Here we are.
Yeah.
So Paula, is your last name Saavedra or do you just put it short as SAAV?
I do. I shortened it because I want to pay homage to my mom and my dad.
Okay.
But Lopez Saavedra is my full name. Yeah.
Because when I read it online, I was like, wait, SAAV is not a typical last name. So I figured there was something going on there.
Yeah.
All right. So real quick, so I'll just start off. I mean, I really don't have an intro or anything. I just kind of go at it. I'll probably put in an intro afterwards. So Paola Lopez Saavedra, welcome.
Thank you.
Welcome.
Thank you.
So I know that you reached out to me. You were kind of like, hey, let's just have a conversation about mental health. Right. Currently, you're in a doctoral program for your PsyD.
Yes.
Where are you going to school?
Albizu University.
And how's that going for you so far?
It's a challenge, but it's definitely fruitful. I was having actually a conversation with myself today about how everything that I'm going through right now is everything that I prayed for 3-4 years ago. And I'm working towards internship, preparing thesis, juggling a lot, but I love the program. It has put us in like a really good space where they lead us and they guide us towards what to do and how to succeed, which is what they're doing now with like our internship prep. So I feel really good.
How have you grown as a person as a result of this clinical track that you've been on?
Mostly time management within myself, because I had to separate like, yes, go for it, keep studying, don't see your friends often, and also just balance my life and my mental health and wanting to move my body. So I feel like it's definitely given me time management skills and just patience with myself.
So most people struggle with that though. So how have you been able to find that balance? Because so many people kind of go all in and they completely abandon part of themselves. So how have you been able to achieve that balance?
Through my own healing process. And just being aware of what makes me feel good and what doesn't. You know, immersing myself in the college post-grad experience is time consuming. And I did lose myself, I feel. I was just dedicated to that. I wasn't really seeing my friends. And so the balance was, one, making time for myself, giving myself rest, whatever that may be. It may be sleep, or it may be just scrolling through, whatever show is popular on Netflix. And also movement and being outside, mostly just breathing fresh air after hours and hours of being inside staring at a computer.
Yeah, because otherwise, I mean, the stress level, I'm sure, is high. You have papers to write and just deadlines behind deadlines.
Yeah.
And after a while, it just becomes consuming. How old are you right now?
I'm 28.
So how were you able to, what year are you in school right now?
I will be finishing my third year this summer, entering fourth in the fall.
But third year after your bachelor's? Or how's the program? I'm sorry.
So I did graduate with my bachelor's from FIU. I took a year off, and then I started the PsyD program, which is 5 years. And along the way, they give us a master's in general psych.
So how difficult has it been for you? Because you have to sacrifice a lot of social activities, going out, parties, family events, and everybody tries to pressure you. Like, they don't understand your deadlines and what you're going through. And sometimes you have to be selfish and say, hey, this is right now, I cannot. This is for me. This is for my future. I can't go. I can't attend. How has your family and friends responded to that?
My family has been super supportive about it. My parents aren't the type to have lots of activities going on during the weekend. So, but mostly my friends, they're like, oh man, to the point where they almost stopped reaching out for some time. And that kind of got to me because I'm like, am I losing my friends?
Yeah.
But I think it comes with also, what do I want to make time for? If my friend is inviting me somewhere 2 weeks in advance, I'm like, okay, well, then I have to find a balance within my schoolwork, movement, time for myself, and also being able to show up for somebody that I care about. So at first it was difficult because I was like stuck between, do I only do this? It was kind of like one extreme to then having that social aspect. But I'm more towards like the middle now of like, I know what I want to make time for and how I need to time manage. Like, will I give myself a little bit less rest so that I work on this paper a little longer so then I can make it to the social event 2 days from now? Then that's kind of that balance that I'm leaning towards more these days.
Did that wisdom and experience, did that come with the experience? I guess that ability to just delineate, like, okay, I need to make time for this. Did that come with time, or was it something you kind of was somewhat innate and you knew you had to do it from the beginning?
I think it came with time, but also it was down there in the subconscious of like, this is what you need to do. It definitely came with experience of trial and error of, denying my friends invites and requests to do things together, whether it just be hang out at my house. And so I saw how unhappy I was about denying that social aspect of me. And so I feel like it mostly came within these last 3 years. I was like, okay, like I am allowed to have leisure. I'm allowed to have fun.
I know that you're Colombian, correct? What part of Colombia are you from?
Bogota.
So you're from Bogota. How old were you when you came to the United States?
I was 4.
So you were 4 years old.
Yeah, in 2001. No, 2000.
Because you mentioned to me in just a general synopsis you sent that it was kind of difficult transitioning from being a very rich, coming from a rich family in a poor country, and then now being lower middle class in a very rich country or wealthy country. How can you, or I guess, how did you see that, especially since you got here at such an early age, and now that you do see it and have experienced it, I don't know, how have you dealt with it?
I didn't realize the difficulty until like later on when I was maybe like 20 something, how much my parents sacrificed to give us this life, me and my brother. How did it affect me? My parents were working a lot. I was taken care of by my aunt, who was a stay-at-home mom. So yeah, I grew up with my cousins, which was great, that social interaction, but not really getting to see my parents, right? And I didn't really understand it back then. Like, it was just like, they're working. They're trying to do everything they can. So I guess that support that we needed, because we were all going through a transition, an adjustment of picking up your stuff and getting, to a new country where you don't really know anybody but your family, and having for them to find jobs and all that stuff. And I remember seeing my parents struggle with like providing. And so that affected me, I guess, in a way where I created also this urgency to need to prove myself through work, because that's kind of like how they felt like they needed to do it. It's like, well, what other way to live if not to prove ourselves through work and having to survive and provide? So this urgency, I call it the urgency syndrome of like having to be successful and having to do it at a timely manner. And so I'm trying to step away from that. And, you know, it's affected my parents because it's like they haven't even been able to slow down. You know, recently my dad got Saturday and Sunday off after working 6 days out of the week for X amount of years. And he's like, I don't know, but what am I going to do? How am I going to pay the bills? And I was like, we don't really know, but just relax, like just hang out, you know, give yourself that extra day of rest. And so I think I centered around the question there. I mean, I circled around the question there, but I feel like that's how that transition has affected me.
How has your dad adjusted? How long has it been since he was able to have that weekend off?
I think it's been about like 6 months, maybe a little bit more, since he has Saturday and Sunday now. He's loving it, but there's always that underlying worry of money. What am I going to do? Oh, no, we can't do that because I have to pay this. Or no, like, let me save my money and not spend. Because, you know, in case of a rainy day, and I get that.
Of course.
But it's like you're never really resting because you're constantly thinking about that struggle of what am I going to do next for money?
I mean, but that's the struggle of the immigrant, right? Because you're transitioning from a country where you were stable, you knew the language, you knew the culture, you had friends, you had support.
Yeah.
And then you take that risk, you bring your family to another country where, I mean, it's not just, you know, flowers and I don't know. It's not an easy road. It's not an easy road for any immigrant who comes here. Yeah. I'm just curious to know how, after being so charged from the sympathetic perspective, how, if he was so charged for so many years, how is he able to exhale? How is he able to just sit down and relax? Right? Because I feel it now. I've been in this mode of entrepreneurship for 3 years now. And the weekend comes and I'm not stopping. Like my brain is still churning. 10 p.m. I'm laying down in bed and I'm still processing different things that are going on. So I can't imagine what that's like. And this is by choice, right? So now you're an immigrant. You come here. Now there's not a choice. Your back is against the wall and you have to fight your way out. So I'm just curious to know how that's affected him. Does your family openly discuss mental health or mental health issues, or is that taboo?
It's very taboo. I was open to my parents about my own healing experience and going to retreats and having, you know, group therapy and all these things. And my mom was open to the conversation, or at least she would just listen what I had to share. But my dad would like kind of zone out. Like I could see him in front of me next to my mom kind of just zoning out of what I'm saying and what I processed, I guess. So in terms of like how does he decompress? I don't think he does. I think it's a response by disassociating through Netflix, or just kind of, which is what I see, you know, like they're just hanging out together on the couch, and occasionally maybe they'll ask me like, hey, can I take your dog out for a walk? I'm like, okay, cool. But I don't see like that there's a complete decompress of that sympathetic ongoing response.
And who is your mom and your dad's support system? Like, I'm sure, I'm going to just take a wild guess. Your mom has a bunch of women friends who are probably also Colombian, and your dad probably is more solitary.
Yes, on the solitary, but I feel like for support, I think he has one of my older cousins, and his sister. Okay. And my mom, I think her parents, mostly like her dad and some of her siblings.
Oh, so it's very tight-knit with family.
Very collectivistic. Very.
Why do you think that is? Just as a means of survival, or?
Also what they've been taught. Like, that's how they grew up. They grew up with, like, the whole block knew each other in Colombia, you know? And that's how my parents met. They were, like, neighbors from, like, 2-3 houses down the street. And so it's, like, the more that we're a community, like, the safer that we are. which is different because when I come here, I'm kind of like taught in school, like be an individual, like break out free, like you were out of the house by you're 18, you know? And so that was like the expectation. And so being individualistic distanced me from my family for some time because I was like, okay, like I have to adjust to this life of being independent and not really relying on my parents the way that we see in the books and the movies and the shows here in the United States. And so now that's affecting me because I barely speak Spanish outside of just my parents. And so now in a therapeutic experience, I'm struggling to have those dialogues in Spanish. So I kind of distance myself from my own culture for some time because I'm not really sure why yet.
You're not sure why you distanced yourself?
I guess it comes from maybe some underlying resentment for this transition into a new country, or not feeling like I was relating to my parents, or the fact that we didn't get that emotional experience together when we were younger. So it was like, I want to be an individual. I want to distance myself because I want to be my own person. But now I'm circling back to, I need this community. I need my family. I need my culture. There's so much that I still don't understand about my roots, you know, how my mom is indigenous. And that itself is like a whole, you know, topic. But it's mostly that, I feel.
Why did you say that about your mom being indigenous? I guess, what is the significance in that to you?
I wanted to be really like indulge into the American culture. And I think that's part of the reason why I distanced myself, because when I got my U.S. citizen, it's almost like I got a complex about it. I'm like, oh, well, I'm a U.S. citizen. I only speak English. And then I had a conversation with one of my cousins. She's like, you're Colombian, you're Hispanic, you're indigenous. Like, know who you are.
Know your roots.
Exactly.
Know where you come from, girl.
Exactly.
Yeah.
And so I had to kind of heal that of like, why do I want to be somebody perhaps that I'm not? Like, yes, I can integrate myself to a community and like to the American culture, but I don't have to completely lose myself.
Well, that's so interesting because I had the exact opposite experience where I wanted to completely immerse myself in Cuban culture, reading about my history. And I was born here. I was born in the United States, but I felt like, my roots are there. When I went to Cuba for the first time, I was 25 or 26. I went by myself, and it was a nostalgic experience to a place I had never been.
Right.
So it was
almost
so
like you had lived there already.
No, like I was like, my life was supposed to take place here. Why am I not here?
Yeah.
And what are the events in history that transpired that ripped me and my family away from this country?
Yeah.
And I'm sure you could relate to that.
Oh yeah, yeah. I had asked you about this.
This Pablo Escobar in a mariachi outfit that everybody asked me about. Yeah.
Yeah, and you bring up a good point. Like, what did it take for us to get here? You know, and so prior to us leaving Colombia, my dad was like a humanitarian, and he worked closely with an organization that was closely to UNICEF. And so he would be out in the community, in the indigenous tribes, and like provide in any way that he could. And to the point that that's what led to our migration, because he was threatened by the FARC, I think is, I say it in Spanish, you know, that's FARC. But so my dad was like, okay, we need to get the hell out of here. Like, because if you're kind to people, I guess in the jungle, it's like, I'm not really understanding that part. But, you know, prior to that, it was all the terrorism that Pablo Escobar incited in the country. My mom, was like a couple blocks away on one of the bombs that he dropped in Bogota. And she was like 20 something, maybe close to 30 at that point. And like, that's scary, you know? And so all of that led to me feeling this way of like, I want to be American, but like so much of that has like so many events and trauma has transcribed all for my parents to decide we're leaving, we're moving.
I just want to put it out there that was there. This was not intended to trigger you in any way.
No, not at all a trigger. But it's a funny picture.
That's the only reason I bought it, because I was like, who has a picture of Pablo Escobar in a mariachi outfit? But I guess it's the equivalent to Che Guevara to many people in the Cuban community, right? Where I have a photograph back there. I'll show it to you afterwards, where it's just Che Guevara's face on a brick wall behind. It looks like rubble, but there's an old woman in front of it. And to me, it was like symbolism right before my eyes, where I said, wow, the way that this woman looks aged and just, it's just a reflection of what Che Guevara and Fidel Castro did to Cuba. And when I displayed it at the Carnival on the Mile, I had a booth up and I had all my photography up, and people would walk in and see it and confront me and say, how dare you have that up? And I was like, wait. Like, I'm not paying homage to Che Guevara.
Right.
If you understand the symbolism of the picture, and you see how destroyed it is and how decrepit the woman is.
Right.
This is just
representative of what happened.
Completely representative. But people they are so triggered that they couldn't process that.
Yeah.
And it was just, how dare you put that up there? And my only thing is, we can't have this conversation. You can't teach your kids how evil this man was if somebody isn't putting it up in some sort of way. If you just want to hide it. And I think this this is very much part of our culture. Yeah. We want to just sweep everything under the rug. We want to not talk to the neighbors about it. We want to not disclose it to anyone. We don't need to see el loquero. We just need to suck it up and keep working and move forward.
Yeah.
And that's not the way to healing.
Yeah.
That's not the way you heal from trauma.
Right.
So just to transition, your work is in trauma, right? It's more trauma-informed care, TIC.
Yeah.
Tell me a little bit about why you chose to work specifically with, I guess, traumatic experiences in people and helping them find healing.
My own experiences. I found psychology as trying to get the easy way out of school. And it wasn't until I took those classes that I was like, oh, I think I can understand a little bit of my own psyche. And then that kind of pursued to I could help others. Trauma-informed care for me is important because it's not just severe trauma. It's also complex trauma, people who have neglect from childhood, people who, had maybe parents in prison or something, in a way that's trauma, and how that leads to anxiety and depression and even worse, PTSD.
Yeah, so often people, it's okay. So often people view trauma as these horrific accidents, as a plane crash, as losing completely somebody dying, a horrific car accident that you witness, a death in the family, which all of these are absolutely traumas.
Yes.
But there's so many nuances to what traumas are. I guess, can you dive a little bit more into that so people have a better understanding of these smaller traumas that I know you already mentioned a few. Is there any, I guess, to just give a little bit more of a description in terms of what traumas people may experience that they might not even realize or see as a trauma?
Yeah. So we have acute trauma, which is usually something that happens one time. It's severe, or it could even be a really messy divorce with your parents. And then there's chronic trauma, which is, it could be a single event that occurs often, something like domestic violence. And then there's complex trauma when it's almost like a mixture of a lot of things, like a divorce and then also domestic violence. And then I got bullied in school, or, I witnessed a car accident, all of that combined. And so trauma could even be an athletic injury. I had trauma to my knee, and I feel like I carry pain there because I had this idea of what I wanted to do with dance when I was younger, and then I got injured, and then I completely distanced myself from dance, from that art of being in tune with your body. So even that could be trauma, and it all affects our nervous system, because again, I hold trauma sometimes in my knee in the sense that I still feel pain, and I've processed what that was like, and in therapy and stuff, but it comes off as responses, right? And then when you said trigger, it's like there was no physiological response about it. It's funny, but you know, people get stuck in those modes, right? I like I got rear-ended kind of one time, and before I got rear-ended, the person honked at me for like a good minute, it felt like. And afterwards, after like the whole thing resolved, like a weeks afterwards, every time I would hear honking, like prolonged honking in the street, I would get like antsy because I was like, oh my gosh, like I almost crashed really severely. And so it could be that fight or flight, or it could be that freeze where, you know, we see something that reminds us of something and we kind of just tense up and we stay there.
Yeah, I had the same response. I was rear-ended by a drunk driver when I was on a motorcycle when I was 22.
Whoa.
And it was the screeching tires followed by the impact flying in the air. And I can visualize everything that happened in slow motion. And later on, when I wanted to ride a motorcycle again, I jumped on my uncle's motorcycle, went down the block, and when I came to an intersection, somebody slammed on their brakes. So you hear that? So all I did was duck my head and brace for impact. And as a result, I said, once my eyes opened, I was like, oh my God, I'm tachycardic, I'm sweating, I'm shaking. And all I did was take the motorcycle back, left it with my uncle, and said, I'm done. I haven't ridden a motorcycle since. Yeah. So something like that where, completely altered my behavior. I always enjoyed the motorcycle, but that event completely just changed me and doesn't allow me to even want to partake in that. Yeah. It's too severe. The risk is too great.
Yeah, it creates like a safety response. Like, how am I going to keep myself safe from these triggers, that sound, that noise, that smell, or that picture, whatever it may be. You know, it's about keeping ourselves safe, but sometimes it becomes pathological because now we're avoiding places or we're fleeing places where we're supposed to be and things like that.
So I know your thesis is in breathwork. And you mentioned a little bit about how those breathing patterns shift during these traumatic experiences. Tell me a little bit about that and how that, I guess, how it's involuntary and how it just kind of happens.
Yeah. So back to, I guess, that example of kind of being in that car accident, I would tense up. And so like, it's almost like I would internalize pressure, like in my spine kind of. And so I would tense up. And I started suffering with like low back pain. And so I did this multiple types of breath work where you access control, right? Because sometimes our fear responses is a response, but it's almost like we don't really have control of what's happening to our muscles, to our breathing, to our physiological responses. And so breathing allows you to, one, quiet the mind, and two, gain that control over like what I'm going to tense and what I'm going to release. And so, you know, the inhale is that activating the sympathetic nervous system, which is like, let's go. And then the exhaling is activating the parasympathetic system, which is the one that's supposed to regulate and bring us back to homeostasis. And so for me, it was like relieving because I can send my breath in a way to that lower back pain. And then I'm able to concentrate on it and release, and things obviously come up, right? Like, I've cried a couple times during breath work because whatever memory or whatever came up, right? Because I'm only focusing on this breath. So I found it really important because it helps us also access some of the memories that we've kind of repressed away or some of the experiences. And so in a way, it is trauma-informed care in the sense that you would be able to reprocess some of these experiences that people have gone through in a way where you don't have to be medicated, in a way where it's not, you know, a talk therapy. Like, people don't really like that sometimes. And so I found it to be kind of like a mind-body connection type of intervention where it really only requires one thing, is just breath.
Yeah, the first time I experienced breath work was an intro to psych class in Miss Peterson's class. Miss Peterson attended Miami-Dade College. And she just had us lay down. I had never done anything like that. Everybody laid down and she had us focus on our breath. We tensed up some of our muscles in our legs, our hands. And I remember just zoning out, going somewhere completely different. and saying, wow, how come nobody's ever shown this to me before?
Mhm.
And even just recently, I did a little bit of breath work with students in an elementary school, just for like,
Oh yeah, I saw that
yeah,
video.
like maybe 2 minutes. And I did some guided imagery, and I took them to the beach.
Mm.
And when I brought them back, they were just like, wow. Like, I didn't want to come back. Why'd you bring me back? I was at the beach. Like, I was
Yeah.
having a good time.
Yeah.
And so it was just a beautiful thing. How can somebody have access to breath work without somebody to guide them through it?
It's a good question. I would say at first, if somebody would want to start breath work, it would be a guided thing where you're learning the different types of techniques. There's alternate nostril breathing, there's diaphragmatic breathing, there's box breathing, right? So it's first being guided and then finding what works for you and finding what actually regulates you. And afterwards, it's kind of just practice in applying, like applying it to yourself and just taking that moment, taking 10 minutes to your day. And I say that, and sometimes I don't even do it myself, but it really is just 10, 15 minutes of your day and being able to translate what you've learned and then being able to apply it.
And so I know that you mentioned the patterns of breathing that occur like during these traumatic experiences. What happens during a traumatic experience to your breath?
So if you experience something like a car accident, right? And the thought or the belief is, I'm going to go to the hospital.
I'm going to die. That's exactly what I was thinking.
Yeah. Your breath gets accelerated. And it's almost like you start to hyperventilate. And then that creates tension in the body. And so some people may not struggle, which is sometimes where panic attacks come from, because it's future-oriented thinking. And then it's like your system is already responding. The sympathetic nervous system is activated. And then you think that you're out of breath, but it's really just your body preparing you to fight or flight. And then you have short breaths, or like, it's like in a way that's short breathing, and you're not really helping the system to regulate at that point. It's almost like you're exacerbating it by breathing so shortly. And so when we take a deep breath, right, and then we exhale, it's like we're telling the system to just chill.
Mm-hmm. And so, but how does that help? How would you tell your mom and your dad, respira, like use your breath to heal? How do you convince them of that? Because it's something so simple. We all breathe. This is not a medication that we have to go and buy. It's nothing that we take or ingest. It's just breathing. So how can we show them? How can we explain to that audience, like, hey, this is important, and we really should be a little bit focused on this as well. Yeah, there's a lot of other components that we need to look at, but this can really bring healing to you.
I think what I tell people often is that we're taught that breath is an automatic response and that we don't really need to think about it, which I think is what leads us to not think about breath and what leads to these reactions and these things stored in the body when traumatic experiences occur. And so it's kind of like asking them, like, how conscious of you are you of your breathing? And I mean, I wasn't. And so I would say it's almost like just bringing awareness to the fact that, like, do you or do you not consciously breathe? And then kind of just facilitating like a breathing exercise where we're just like, okay, what did you experience while you were breathing? Most of the time it's nothing other than, like, being in tune with the breath, like no thoughts, no other outside anxieties and stuff. So, in terms of like my parents, like I've tried and then they're hesitant, they're open to it, but they're hesitant. And that's how I started with it. Like, I was like, hey, like, you're not really breathing. I bet you are, but you're not consciously breathing. Of course. So I feel like that would be an outlet. In terms of like therapeutically, I would say it's kind of like, let's try. And if you're not comfortable with that, that's okay.
Yeah.
Because some people, have no control sometimes of their thoughts. And it's it's scary to slow down.
It is scary to slow down for a lot of people.
Yeah.
Yeah, because if they're on go mode, there's no time to have to dig in and look inward and kind of sift through the different things and experiences they've had. It's just we're moving forward.
Yeah. Or sit in silence, you know, those 10 minutes of like silence that you would do in a therapeutic room or by yourself. Like, can I sit with myself? Can I sit with just this frequency music or this like lo-fi music? Some people just can't.
Or just silence.
Silence, mostly.
Because I think right now we're living in a time where I'm taking my phone in the shower. I'm listening to Spotify while I'm in the shower. We're sitting on the toilet and we're scrolling through social media. Everywhere we go, there's some sort of noise that's going on that's artificial. And they're all distractors. Actually, I was just on a boat this weekend. And I was just looking at all the crowds. And I don't know, when's the last time, have you been on a boat recently? My pet peeve is the fact that the guy that's 10 feet away wants to blast his radio louder than our boat.
Yeah.
I really want to regulate it so that just one guy says, hey, I'm going to be a DJ for a little while. If you guys don't like me, you vote me out. We'll go to the next boat. And I started to look around and I was just like, nobody's really conversing. Nobody's really in thought.
Yeah.
It's just music that's blasting. That's all a distractor.
A distraction.
Because it's either, can you not have conversation? Because if you sit there for a while and you start having an exchange, you might be able to dig a little bit deeper. And your friend might ask you these questions that have meaning and force you to look inward. But then we're avoiding it with noise. Don't get me wrong. I love music.
Right.
I love it. I love music. Play reggaeton, play whatever you want. I don't care. But if we don't have these exchanges as humans, like, what are we doing? Like, I'm out with my friends, but I don't know who my friends are. And nobody's challenging me or asking me about what I've been through, what I've experienced in this journey we call life. Because I just hung out with my friend Tony, and I haven't really seen Tony for like 4 or 5 months. Man, I've been through a lot the past 5 months. But there wasn't even an opportunity to say, hey, man, this is what I'm going through. What do you think?
Yeah.
What have you been through? Oh, wow. I've had that happen to me too. Let me tell you what I did, or just be there to listen. Yeah. So I think silence is so powerful, but we're avoiding it right now. And it's probably what you just said. We don't want to look inward.
We don't want to sit with ourselves.
Why? Why do you think that is?
It could be like an overwhelming sense of these pop-up windows, which are our thoughts, right? It's almost like we've lost control of how closing all these pop-up windows. And, you know, it's that reluctance of maybe I can't do it, that I can't shut the world out. But, you know, you make a very good point. Like, people are distracting themselves. Whether they know it or not, like through music, through Netflix, which I've done, you know, and through conversations that are very superficial. Oh, how are you doing? Oh, cool. Yeah, great. Got to hear you're good. Let's go have this drink, or let's go whatever. I also feel like people are afraid to relate and to build community out of their own shame, maybe. Out of not feeling safe within themselves to be like, this is what I'm struggling with, even if it's a close friend.
But I feel like everybody's preaching community right now. But then it's all so superficial.
Yeah.
Like, we're all going to this yoga event and we're all partaking, and that's it. It's not really community. Yeah. Community is so much deeper than that. But then everybody wants to say, I'm building a community. But you can't really build a community if you're not vulnerable.
Yeah. I feel strongly about vulnerability. I feel like that's, if anything, our superpower as human beings. Because we do want a sense of community. We're social animals, right? But without relating to each other, how can we build this community? If I don't say I'm struggling and then you're like, I'm struggling too, I'll never feel close to you. I'll never feel connected. You know, yeah, we can hang out every time, but if there's not that connection of, wow, this person understands me simply because they've been through something similar, it doesn't build anything. And so being vulnerable is very important, not only with your family, but I feel sometimes even with like my clients. I won't obviously overshare and self-disclose the details, but I'll be like, hey, I've struggled with that too. And sometimes this is what helps me. Sometimes this is what's not. And so we need to know that we're not the only ones experiencing whatever we're going through, whether it be exact or similar. That's what builds community.
Yeah, just letting that person know. I would tell patients that came in with a panic attack. I didn't have a panic attack till I was 36 years old on an airplane. I don't know if it was the edible I ate in Boston. I don't know what it was, but it was the first time I experienced a panic attack. And so then it definitely changed the way I educated the patient on it. Because before it was like, oh, use breath work, use guided imagery, just know that it will pass. But when it was happening to me, I knew all those things and I was doing those things and I was slowing down my breathing and I was letting myself know, but the response was way too much. It was way too heavy. And before you know it, I'm sitting in an airplane with my shirt off and the flight attendant comes by. I was like, sir, you need to put your shirt on. And I'm like, the shirt is draped over my neck like this. And I'm just like dripping in sweat. And I'm telling the lady next to me, I'm so sorry. I'm just really going through it right now. And I think the flight attendant, after the second time she came around, I just looked at her and I was like, I'm not feeling well right now. And then she brought me like a wet towel and stuff like that. And then a huge glass of wine that I asked her for. But I can't help my patients. Or I'm sorry, I could better help my patients after I had that experience by being vulnerable and saying, hey, I understand what you are going through. And this is why you should do X, Y, and Z, and perhaps have an emergency medication with you just in case that should happen again.
Yeah.
And then by me being vulnerable and with self-disclosure, they were able to say, oh, wow, you're human. You've been through this too. You're a mental health professional and you've suffered from this same thing. Hey, I should listen to you and I trust you more now.
Yes.
And now I feel more connected to you.
It builds the rapport. It builds the connection. And you humanize yourself, right? We're not any different than the person that's walking into our office. We struggle, right? And so I feel like that's one of my principles in therapy, like being a little bit self-disclosed about my own struggles in relation to what they're going through. Obviously, it's not about me, right? It's more like, hey, I've been through this too. This helps me, this didn't, like I mentioned. And then having them think about like, wow, okay, maybe I could try that. Maybe that works for me. And then exploring like, what can we do to help me, right? Them, obviously. Of course. And giving them options of how to cope with things like that. Sensory wise, whether it be breathing, that cold towel, that's sensory. People love that, right? That's what regulates and grounds them. Other people do breath work. Other people reframe.
That day was wine. It was stimulating GABA. That's what it was. For real, it was rough. So you did mention to me using breath work to reach or enter altered states of consciousness. Talk to me a little bit about that.
Okay, so one of the breath works that I'm writing about in my thesis is called holotropic breath work. It's facilitated by a professional. You have like music in the background that it's supposed to allow you and encourage your mind to kind of let go. And so in a way, it's like hyperventilation. You're only exhaling. You're taking tiny, tiny inhales. And you're exhaling. And so in a way, you're letting down your defenses. And then whatever control the body kind of has, it releases that. And so you're still, or you may have like some tingly feelings, but your mind is what travels, right? Like you're physically there. You're laying down. People are watching over you. You have a sitter. And so you are able to go wherever kind of the mind takes you. I've done this breath work before, and at the time that I was doing the breath work, I was experiencing a lot of fear about outside stuff, school stuff, and that translated to kind of like a moment in this altered state where it felt like I was falling into an abyss. And although it was prompted by the facilitator that this could be a representation of the womb, even though it was prompted, like it could be, it doesn't have to always be interpreted that way, but I understood it as fear, that I felt like I was falling or failing maybe. And then, you know, with the prompting of the facilitator, you kind of attempt to come back to these places and reintegrate them in a different way, right? Your eyes are closed the whole time, but you're still able to communicate with the facilitator. So they'll ask you, like, how are you feeling? What do you see? What do you feel? Who do you think is there with you? Yeah, I've had other people that did the breath work with me in that group setting that, you know, shared that they felt like they had a vision of what their future is going to be like and what they needed to do to get where they needed to go. So in that sense, it's altered states because our mind goes without controlling where we think that we're going or what we're feeling. I'm not sure if that really explained it well.
But this is all through the use of breath work.
Yeah.
And the reason I ask that is because right now people are using psilocybin, still illegal in the United States, but they're using ketamine, they're using ayahuasca, also illegal in the United States. Yeah. But they're using these different hallucinogens and different neurochemicals to help them reach the altered level of consciousness that you're describing. Mm-hmm. So how can obviously breathwork is completely legal. But and it's okay if you don't know. I'm just curious. Do you know if there's any difference in terms of what you can achieve using simply breath work versus using ketamine or versus using psilocybin or ayahuasca or any of these things? Because right now this is very trendy.
Yeah.
Very trendy. I've had a woman who approached me on Instagram and I met up with her and she had the scars all over her arms from, I forgot the name of the frog that she uses the poison from to help what we're describing right now. Mm-hmm. Again, not legal, but she's promoting it on Instagram and doing it openly. So I'm just curious, like, yeah, how can I tell people, hey, there's definitely a modality of treatment using breath work that you could use to help find healing, to help travel to these places, to help you kind of organize your thoughts that normally you wouldn't.
I think the big thing there is that you're taking a substance that has biological reaction to your body. And so, yeah, you will access those altered states. But in a way, sometimes those could be distortions of your mind. And so I feel like that's the main difference when you compare the two. And maybe that's people's apprehension to trying this type of therapies in terms of psychedelic assisted therapy and stuff, because they have to take a substance and there are side effects. And so I guess the main difference is, like, what are really the side effects of breathing? So
I think you just said it. Yeah, there's no side effects associated with breathing, right? Yeah. We all breathe all day. So if we could use that, so I think what it is that people don't realize how powerful their breath is. Mm-hmm. They don't realize that it could definitely take them to another place. Yeah. The first time I underwent hypnosis was I was sitting in the back of a psychiatrist's office while I was doing my hours, and he was doing hypnosis to a patient. And he told me, he's like, this is a script. You can follow along so you could experience it as well. And I did. And I felt the room inverted. I went back and I had no idea. I was like 20. I forgot how old I was, but I had no idea that I had some sort of traumatic experience related to my very first relationship in high school. And I went back to that relationship in that state of hypnosis. And I was like, wait, I didn't even know this affected me at all, because I dismissed it as just my first relationship, puppy love. Yeah. But there was a lot of trauma surrounding that. Now, looking back, obviously, but at the time, I just thought, oh, this was an event that happens to most people. But it was everything, all the nuances of that relationship that were also intertwined and became part of me and were part of my subconscious, right? The rejection.
The beliefs we create.
Exactly. All the beliefs that were created, because that was so profound. It was my first experience with love. So how did that shape me? And here I am later on in the back of a psychiatrist's office who told me, don't worry, just follow along. And I'm hovering over my life back to high school, which I had no intentions of doing.
Right.
I didn't even know that.
You weren't even prompted.
I wasn't prompted at all. I wasn't like, oh, go back to high school. No. That is where I went.
Yeah.
That is where I went. And then it made me realize, oh, there's definitely some digging I have to do here.
It kind of speaks to our subconscious in a way. Because of all the things that we bury, all the things that we repress, our subconscious kind of stores it. And it comes up in different ways, whether it comes up in a dream, in a thought, like you randomly remember something that happened to you in middle school and you're like, oh, yeah, I remember something, And so our subconscious speaks to us in those ways that it was like, maybe this is now the time for me to access this and heal this part of me. Maybe I wasn't ready then. And now the mind's like, let's throw it in there to see like, what's up? Like, can you handle it? Is this the final test?
So do you feel that people need breath work in order to tap into these different instances?
I don't know about need, but I would strongly encourage it. Through psychodynamic psychoanalysis, you can dive back deep into these things. But it's like, are you willing to? It's like, are you willing to try? And so with breath work, you're vulnerable and you're releasing the control, right? Of like, okay, I don't want to access that. So I'm not going to talk about it, right? Which is what happens in therapy. Some clients are just like, yeah. And so it breaks down those barriers of your ego, the breath work, just like psychedelic assisted therapy. It breaks down those barriers that your ego's holding so strongly to keep you safe, to not access these repressed memories. And so when you're in a breath work, in hypnosis, in hypnotherapy, those barriers are gone. And so now it's the mind. The mind is like, what can we, And so it's like, it's the mind fully controlling the psyche at that point, our understanding, our reasoning.
Yeah, because a lot of people go to therapy, and this is why I require students that, at least that I used to work with, I wouldn't require it because I couldn't require it, but I would strongly encourage and say, listen, if you're going to be a clinician, you have to go to therapy.
Yeah.
Because it's very different for you to ask these questions. To ask these questions that make somebody so vulnerable, and you're poking and prodding at the most delicate parts of their life, traumatic experiences, and you're just asking blatant questions and just expecting responses out of nowhere. You have to experience that, know what that feels like when all of a sudden they ask you a question and you get guarded. And you don't have to verbalize it at all, but internally you can say, I don't have to go there.
Yep.
She doesn't need to know this.
Right.
I don't have to disclose this to anyone. So how can, and I'm just asking in general, I'm not really asking you, but how can we get patients to recognize that without that vulnerability, or when they're in therapy and they feel that guard come up, oh, I need to write this down at least because this is something I need to address. Because I'm guarding this. And why? Why does this make me feel unsafe if I put it on the table?
Like to them, their experience
Exactly.
of, yeah. I mean, I think it goes back to that, what you just explained, like that need for providers to also be on the other side of things. It's like, I understand why this person is guarded. I has to come with that compassion. Or maybe they're not ready, and that's okay. But we're not also going to push our clients.
Yeah.
If they're not ready. I recently experienced that with a client. They kind of had their guard up, and I was like, okay, so what do you want to talk about today? And they were like, no, everything's fine. And I was like, okay, and I understood, in a way, they're mirrors of ourselves, our clients, where something that they say can have a response in us. And that helps us also grow as clinicians, because it's like, oh, well, I didn't know that was going to bother me until it did, right? And then that's why we process it in therapy. That's why we have supervision and things like that. There's not much, I feel like, when it comes to that resistance and those barriers that we can do other than just be compassionate and be like, hey, it's okay. Like I've been, again, that vulnerability of I've been through that experience too, where I felt like I didn't want to talk about those things, and that's okay. You're ready when you're ready.
Would you ask them, like I said, to either write that down or just take a mental note and say, hey, you should definitely consider why you're protecting this or why you don't want to discuss this?
Oh, yeah. Sorry, I missed that part of the question.
No, it's okay.
Yeah, absolutely. Kind of just like, okay, like let's put a tab on that, or like see if maybe you can journal about it. All depends on what they like. But I've definitely done that to clients where I'm like, oh, well, why don't you journal why you feel guilty about X and Y and Z? And they'll come back and they're like, wow, like I found profound information about myself just by journaling about this question of why I feel this. I think that is probably the most helpful thing, like to point it out in a, kind manner of like, oh, well, okay, this, I guess, is a touchy subject. Maybe, explore that a little bit within yourself and see what comes up. Writing it down, making note of it, or just seeing if they can process it within themselves. And maybe next time we'll talk about it.
It's a difficult field. I take my hat. I mean, I've been a clinician for a long time. I've been specifically in psychiatry since 2010, I believe. But therapists have definitely taken the cake in terms of my respect, just because you guys are really in the thick of it. As a psychiatric provider, we can definitely address symptoms. And sure, during the initial eval, we can dive into the trauma a little bit and we can, but you guys go into the mud. And you do it day after day after day, patient after patient after patient. So it's very different. It's very, very different than psychiatry because, again, I can focus on symptoms and then just, then let's look at a medication.
Yeah.
Right? So it takes a special person. What do you think drove you into this field? I know part of it is just your own personal experiences. What made you choose psychology initially? Because you said it was just an easy degree.
Yeah, I thought it was.
Yeah.
Till I got into grad school. I think it was an influence from my mom. My mom has been a preschool teacher with this specific philosophy where it uses art and sensory experiences to help the children develop. It's ages like a couple months till 5, right? And so I saw how passionate she was about creating experiences and having, these kids be a part of it and see how they react and stuff like that. And so it was, I guess, her drive to want to create this for them that made me feel like I could create experiences and positive aspects of people's lives in therapy. And also there was an influence with like a show called Frasier, which is like a funny comical show where he's like a radio psychiatrist and he is providing advice. And what's funny about the show is that he goes through his own mental health stuff and his own things. And so it kind of just put two together for me that I was like, oh, well, we can heal while healing.
Because you hadn't thought about that. It's almost like you viewed the healer as this person who didn't suffer.
Right. So detached from the experience of what the client is going through, right? Where, I've had colleagues say like, oh, well, no, I don't really like self-disclosing because it's about them. And yeah, that's true. But are we also healing? Like, are we also treating the things that come up in our clients' therapy that symbol parts of ourselves?
Yeah, I used to write notes all the time after speaking to somebody. And if there was like countertransference or really something happened within me during that session, it's like, why? Why is this happening? Like, why am I experiencing this? I don't know this person, but something is going on within me. And it's not just a matter of compassion or empathy or sympathy. No, this is something that's affecting me. It's affecting the way I view the world. It's affecting me in a just a different, a more profound way. And I have to ask myself why. Because if I'm not, then I'm doing myself a disservice. And then I'm also doing that patient a disservice because that patient's coming back. And so if I don't do some digging within myself,
I'm going to feel disconnected.
Yeah.
Or detached from wanting to help them.
because I might even do it to protect myself from
Exactly.
feeling that again.
Mm-hmm.
Yeah, this is an interesting field, though. So, anything else within the field itself that you wanted to touch on?
I feel like in terms of professional development,
Mm-hmm.
back to that conversation of me wanting to distance myself from my culture.
Okay.
I think in English, I count in English, I mostly speak English in my head. And so now I'm struggling in the field with providing therapy in Spanish.
But how? I heard you speaking Spanish a little while ago, and you're extremely fluent. So,
It doesn't feel that way for some reason within me. I feel like I'm more eloquent in the way, I guess, that the way that I speak in English, but in Spanish, it doesn't feel that way. And so, and my therapeutic language is mostly in English.
Okay.
Right? Like, how do we say cognitive distortions in Spanish? I have to Google translate it and see if it makes sense from the information that I know.
Or you could just describe it in a way that you can explain it in Spanish.
Yeah.
You know what I mean?
My struggle is that I stutter. I feel like I get really nervous because it's performance anxiety, that I want to sound like I know what I'm talking about in Spanish. And so then like I fumble and then I end up speaking English and they're like looking at me like, huh?
What always worked for me, and my Spanish is not anywhere near yours, is just letting them know, hey, I'm going to struggle a little bit in how I explain this in Spanish, but I'm going to explain it in Spanish. And if you don't understand, I will try again to explain it in Spanish. And that way, it just kind of helped. Again, I put my vulnerability on the table.
Yeah.
I let them know Spanish is not my first language. And what they're going to tell you is, actually, I understand you really well. Surprisingly, right?
Yeah. That's what's happened to me. They're like, oh, yeah, no, yo entendí todo. And I'm like, okay, thank goodness, because it just, I guess I get in my head about it.
Yeah.
And, you know, in a conversation in Spanish with, you know, my cousin, it's different because there's that level of comfort and safety as opposed to a brand new client that's coming in and it's about them, you know, and I'm like, I can't make this about me because I don't really know how to speak well in Spanish or something like that. So that's been one of my struggles, which I recently told my boss. I was like, throw me in. Put
Good
me
for
in,
you.
coach,
Good for
because
you.
if it's not now, then, you know, like I'm applying to internship and I'm putting that I'm bilingual. And what if they...
Because you are.
I am. I am. But I just want to sharpen those skills, you know? And so if I don't do it now, I don't want to be thrown into a therapeutic experience and internship and they're, you know, supervising me in the room and I'm stuttering and I'm not proficient.
Why is that important? Not only for you, but for any patient, to simply immerse themselves in the thing that they're fearing or avoiding. Why is that important?
Why is it important to immerse yourself in the thing that they're avoiding?
So for you, for instance, you're just describing the fact that you're afraid of speaking Spanish. It's creating a lot of self-doubt. You don't feel like you're speaking well enough, even though you're getting the right feedback saying, hey, actually, you speak really well. But right now you just said, I told my boss, put me in, coach.
Yeah.
Put me in because I want to learn and grow. Why is that so important for so many people? And if not, I'll tell you why.
Because if we don't try, how will we know?
Exactly.
How will we know? We can't say no to an experience that we haven't actually tried yet. The fear of failure will hold you back, which is what's held me back. And then I kind of had just that realization because of all this internship pressure that I was like, I need to do this now, which in a way is exposure therapy.
It's completely exposure therapy. And the more that you're exposed to it, the more that you're immersed in this environment that makes you completely uncomfortable, the more of a sympathetic response there is. I'm sorry. Initially, there's a huge sympathetic response. You're sweating. Your voice is shaky.
Yeah.
Your heart is racing. You feel insecure. You don't feel safe. But the more that you do it, all of a sudden, heart rate doesn't accelerate. You're not sweating. You feel calm. Your thoughts are clear.
Yeah.
And again, this was something I experienced as well when I was teaching at the University of Miami. Complete imposter syndrome.
Yeah.
100%. I don't belong here. I used to stand up in front of the class and tell the students day one, I'm just a kid from Hialeah. I don't really know what I'm doing here. But here we go.
Mm-hmm.
And at first, I was also put in a place on more than one instance where I probably shouldn't have been taking or teaching that class, but that's a topic of discussion for another day. But still, I had the knowledge and I was preparing myself before those lectures to be able to deliver that information. And day one, I learned not to wear a light blue shirt because then it was stained all the way down with sweat.
Anxiety.
My heart was beating. I would lose train of thought. As soon as a question would come off, it would completely derail me and make me feel uncomfortable. But then by the 6th week of the semester, I felt great.
Yeah.
Like I'm ready. I own this.
Right.
So
It makes me think about the simple analogy of like riding a bike. You know, like, are you gonna give up because you fell, you know, or is it really something that you want to do? And it's kind of that same situation. Like, it's something that I want to do. I want to be proficient in speaking Spanish therapeutically. But if I don't try and I give up quickly of like, nope, I'll just dismiss it and I'll just do therapy in English, but my name is Paola, like, they're going to be like, what are you doing? And so it's about not giving up, even though the fear is so loud and so big. And, you know, your ego will always keep you safe. And that's where most of our fear comes from, right? Keep you safe, keep you where you are. But I'm trying to break those barriers. I'm trying to just try. I really just want to try.
What's been one of your biggest perceived failures that you've been able to overcome? I know it's a hard question.
I'm going to need to think about this one. My perceived failures that have been hard to overcome. I think some of like my social relationships, in a way that they've been hard to overcome because there's been so many attachments to some of the people that I grew up with, right? And we're just not on the same journey, spectrum. I don't know.
Okay.
But it's been hard to overcome because I've internalized it as something that's wrong with me, as opposed to just something that can happen naturally, which is that people outgrow each other. Which is one of been my struggles within like my program. That's kind of kept me distracted from focusing on my work because I'm like grieving relationships from my past. But yeah, I mean, in terms of like personal life, I can't really think about anything professionally.
That's okay. Why does that happen? Why do we crave these old relationships that we've outgrown or we've just moved on from, or the road just kind of, there was a fork in the road and they went left and we went right? Why do we want to go back? Because sometimes that road does come back together in the future.
It could.
And it's okay for it to divide. It's okay for that divide to happen. But I've been through the same thing. People who I grew up with. I mean, by the time I was done with high school, none of my friends graduated with me. And then I still, as I'm furthering my education, I'm going back and not feeling accepted and feeling like the other. And so eventually I was like, well, okay, like I guess I don't belong here anymore. But then I still had some very good friendships where that has never changed or shifted.
Yeah. I think it's comfort. I think it's safety that we want to go where we know. Because breaking away from these relationships is the unknown, feels unsafe. We don't know what's going to happen. We don't know who we're going to meet.
Would you say that's the same thing that happens in romantic relationships? Like, do we stay simply because of comfort, because we know we're familiar, it's safe, it's predictable?
I believe so. I think it's complex.
Of course, yeah.
But it's familiar, it's safe. Sometimes our values drive that. You know, like people who stay in long-term relationships that may not be the best. Maybe it's because they have a value of this is what family needs to be like, or relationships.
I had that,
yeah.
I had that.
And we are afraid. We're afraid, whether it be fear of rejection, you know, our attachment style. We just want a space to feel guarded and taken care of, whether it be, you know, whichever type of relationship.
Yeah, it sounds like it's friendships, romantic relationships, even work relationships. Yeah, across the board. Somehow we find this attachment. And I guess that's why it's so scary for us to transition in whatever it is that we're doing, even when it feels toxic.
Yeah, attachment is, I'm trying to detach from things in a healthy manner where it's not me obsessing over something. I saw recently this quote that it was like, if you obsess over something or someone, it's a false sense of control for your underlying fear of rejection. I was like, damn, you know, but can we attach ourselves to things without feeling a need for them? You know, like, do I feel safe in my friendship to know that I don't have to talk to them every day, speak to, like, hang out with them every day and all these things, but still feel securely attached to this person without feeling like, oh my God, like, what are they saying about me? Why do they hang out without me? And things like that. And so I'm trying to work on differentiating attachment with just safety.
What if someone makes you feel that way? Like most relationships, you feel completely secure. You can see someone, they go away, they
like
come.
Romantic relationships?
No, any relationship. But then there's one particular person who all of a sudden they're very attached to you, but then they just suddenly let go and they disappear, but then they reappear all of a sudden. So is it because of, have they formed such a what seemed like a secure attachment initially, and then now their unpredictable nature suddenly makes you feel like, whoa, what's going on? And you're trying to make sense of it.
Yeah.
Because I recently had that experience where I was like, wait, what am I feeling right now? What am I experiencing in this relationship?
Because you were that other side of, like, they were attached and then they had unpredictable behavior.
Yeah.
I laughed because I recently had that experience too.
So it's funny, we're talking about attachments, and this was something I've been processing on my own and just feeling like, is this person's insecure attachment that they have throughout their life in their being, and now I'm feeling it.
Yeah, it's almost like sometimes we absorb what they, or how their attachment style is, or what they feel. Because
I feel good in almost, I want to say 99% of the relationships that I have. And then all of a sudden I just feel uneasy, and it's like, wait, what is this? Yeah. What's going on here?
Yeah, I think when we feel safe in our relationships, it's because, one, we have trust that this isn't going to impact my well-being and just who I am as a person. And then when there is detachment behavior from others that are, you know, projecting it onto us, it makes you question, like, the way that you are, I feel. And so it kind of made me question, like, am I insecure attached? Am I anxious attached? Like, I'm trying to, you know, work on whichever one it is, to just have safety.
Because we want safety. We want predictability. Yeah, we just want to feel secure. At the end of the day, secure, safe.
Yeah. And in terms of predictability, like, when people are in toxic relationships, that becomes a huge pattern where in a toxic relationship where there's a fight and then now I feel guilty about it, what am I going to do to change the situation? And that becomes almost like a manipulation of, okay, now I know that if I do this, this is probably what's going to happen and how they're going to react to me, and that's how we're going to resolve our thing, even though the same pattern occurs and occurs and occurs. And so sometimes even toxic behaviors can be predictability, where we know that it's going to happen, and in a way that's what we feel like that's what love is.
So people toss around the word toxic a lot. What are some behaviors that you would deem as toxic?
You know, and I think now in the media we see a lot of what gaslighting is.
Yeah.
Which is, the way that I would describe it is when we try to alter somebody's sense of reality. You know, like I experienced this white wall and you're trying to tell me it's yellow. Like, you know, it's similar like that. So I would say gaslighting. The behavior of like pointing fingers, like speaking in you terms, like you did this, as opposed to I feel this way when this happens. That I feel like it's targeting, like it's threatening, right? Like if somebody's coming at me like that, I'm going to feel threatened, which is where your trauma responses come out and you get triggered. When I was younger, I had a relationship where this person was like share locations with me. And yeah. And I felt at that moment, I was like, okay, yeah, like this is how we know that we're safe, right? But it's like, where are you? What are you doing? This and that, da, da, da. And it's overwhelming. And I'm like, let me breathe, you know?
Why are you at Publix?
Yeah.
Who's at Publix
Who's
with
you? Yeah. I'm like, the bag lady.
Yeah. The cashier.
Yeah. So I think it's the enmeshment within romantic relationships that becomes toxic, where there's codependency of like, I don't do this unless you do it with me. Whether that be communicated or just internalized, you know, like I'm not going to go grocery shopping unless you come with me.
But isn't this part of a lot of Hispanic culture?
Yeah.
Where there's a lot of older couples and even still young couples now that have just taken those behaviors in, and they have a joint Facebook and Instagram account and everything is enmeshed.
Yeah.
And they're always inseparable. And when one goes, like I have friends that if I say, hey, let's go to the bar and have a beer. Let's talk. Let's get together.
Oh, but can my partner come?
Yeah. And it's like, I mean, I kind of just want to hang out with you. No offense. She's awesome.
Yeah.
But,
yeah. Yeah. The enmeshment keeps us from being our higher self, like our own person. I feel like I've worked on some of my own codependent tendencies where I would be like, I'm not going to go to the beach unless somebody's going to go with me, until I forced myself, again, with that exposures therapy stuff, to just do it. And so when we become enmeshed is when the things become toxic, because it's like, oh, I thought I knew you. Like, and you have to stay this way because when we enmesh, this is who you were. So if you change, it's a threat to the relationship.
You've changed, man. You've changed.
Yeah, you've changed. It's like, are we not supposed to?
Yeah.
We're ever evolving as a human race and just as individuals.
Of course.
And so I feel like that's where the problem comes in, where we don't accept that people change. And we're holding to those ideas of what used to be, as opposed to just what is or what we want it to be.
I think that's also the biggest loss in a relationship, is when you expect something of the other person. Like, if you're not communicating what you want, you can't just expect for it to happen magically.
I'm not a mind reader.
Yeah. But yeah, going back to enmeshment for sure. For any of my Hispanic listeners out there, you guys can be individuals. I promise you. It does not mean that your relationship is over. It does not mean that she doesn't love you or he doesn't love you. Just to allow one another to live, to experience life, to enjoy life, because that's what we're here for. Yeah. I mean, I've traveled by myself. When I've taken my trips for photography, it's very hard for me to do that with someone else, because I don't go into the same mindset. I have different interactions. I won't put myself in the same situations. I can't be as vulnerable as I want to be. I have to put myself in somewhat of risky situations or get to know people that I would have never otherwise met. And if I'm there with someone else, whether it's my girlfriend, whether it's a friend, it changes it.
Mm-hmm. It's a different dynamic.
And I'm not immersed the way I want to be.
Yeah. You'll be immersed in a different way.
In a different way.
You know,
in a different way.
Yeah, and sometimes it doesn't always like fuel our soul. right? When we're by ourselves, yeah, it's different. And it's like, wow, this is really what I wanted. Sometimes because whether we're with a friend or a partner or a family member, there's compromise in a way. And when we are in paths of our own and doing experiences of our own, we're only really compromising with ourselves. Do I want this? Do I not? Okay, yeah, I do. And then we kind of go for it. And so there's nothing holding you back when we're allow ourselves to be our own person and evolve in that way.
But I think most people don't. Most people, I mean, I would encourage anyone to take a trip by yourself, to go to the beach by yourself, to go out one night and just sit at a bar by yourself. It's okay. I'm not encouraging the use of alcohol for those of you who want to throw me under the bus. I'm just saying, like, you have to live a little bit on your own just so you can experience life as an individual and really ask yourself those questions that you might be ignoring.
Yeah.
What is it that I want? What is it that I really want? What does my soul yearn for?
And so people don't really do it because, again, of fear of going within or just being with their thoughts or their own body.
Or they're afraid of being deemed as selfish.
True.
Yeah.
Which I've always said that, like, there has to be a little selfishness to be selfless.
100%.
And when we're selfless to ourselves, but in a way, technically, that's selfishness, right? Where we care and tend to ourselves the way that we take care of others, right? There's selfishness underneath that. Because it's like, I have to choose myself first or before anybody else.
That's something I really try to I used to tell moms a lot. Because moms, I feel, they fall into that I'm last and everybody else is first. And so they find themselves always last and last and last. And I'm like, you're running on fumes. Like, when are you going to fulfill yourself? So then you have a cup that overflows that you could pour out to everybody else. Like, you need to fill your cup. You have to. It's biblical, people. Like, fill your cup. Fill your cup. Take care of yourself. Get movement. Take time for yourself. Look inward. Heal. And then you can heal. And then you can be there for everybody else.
Nurturing and loving.
Exactly.
And be this superwoman that you want to be.
Exactly.
You know? Which it's funny that I just thought about how in The Incredibles, the mom is Elastigirl because she's stretching herself to all of these different aspects of her life, her children, her career. That just made sense in my mind right now. You know, and it's true. Like, a lot of maybe single parents, if not mostly moms, kind of just immerse themselves in that role where a role becomes an identity and then they lose themselves. Like, who were you before you had children? Who were you before this marriage or even your career? What does your inner child want?
Something I felt really good. This is very random, but something I felt really guilty about was finding some sense of when Eva's mom and I separated and I found myself as a single dad. And all of a sudden it was the week, because we split 50-50. And it was like the week that I didn't have Eva. And all of a sudden I was like, I can do whatever I want. And I was like, wait, I can do anything I want right now.
Did you feel guilty?
There was a sense of guilt, but then after a while I accepted it and I was like, oh, this is pretty cool. So I'm not trying to promote divorce here, but I'm just saying, like, there's something really interesting that happens. And I felt like I was an even better father because I could step away and then step back in and step away and step back in. And so that's something I want people to know, that they're still in a committed relationship. It's okay for you to step away from the family because you need to. And then you step back in. And it's okay for your husband to step away for a second and then step back in. Because why? He's going to be more connected. He's going to feel he's going to replenish himself and live a little bit and then come back and feel like, oh, wow, this is secure. This is home. This is what I need. Sorry, just throwing that out there.
Yeah. No, I think it's almost like when we have everything that we want, we get complacent and we get bored, right? And when we step away from whatever it may be, like our career, our family, just a relationship. And by step away, where it's not like, let's take a break or like, let's not talk to each other. It's more like, I need a couple days in the office or in the library or whatever it is. And we're stepping away. There's that longing for what we love, which adds value to why we love it and why we want to stay. But if we're there and we're consistent and it's just like a repetitive pattern, that's where people get unhappy and they want to like give up.
Yeah, they say distance makes the heart grow fonder, right?
Yeah.
And so the distance doesn't have to be like a physical distance,
It's
like
physical.
you're traveling to another continent. It could just be just that physical distance where you have that time for yourself.
It could be like physical distance as like, I am going to the gym for 2 hours. Or I'm going to yoga for 2 hours. I'm going to go catch up with my mom. Like if you're in a committed relationship, right? It's like, oh, I'm going to go see my mom and take her out for a couple hours. And then you come back, you're like, oh, happy to see you, wife, or whatever.
Of course. Yeah, nobody should be preventing you from maintaining relationships if you're in a relationship.
Yeah.
You should be encouraged to go see your friends. You should be encouraged to go see whoever it is that you love that you want to go, except if it's an ex, you know, that's different. But don't do it, guys. Don't do it. But I really believe that if you're in a relationship where somebody's trying to prevent you from seeing your friends, like that's questionable. Why? What makes them insecure about that group of friends? What's going on? And if there's red flags, that's a red flag.
That's definitely one.
Yeah.
Again, it's that control, right? Because if I control you from having relationships, I am controlling you to be my only relationship where I feel safe. This is about me now. You know, like I feel safe because you're here and you're not hanging out with anybody. Because if you're hanging out with anybody, whomever, then these thoughts of what are they doing, this and that, come up, right? So that's, again, like that enmeshment of control, of manipulation, of just toxic patterns. Like we have to be ourselves, right? Because even if we allow the other person to go, but then we're feeling guilty and then we're sitting at home doing nothing, how is that helping? You know, you also are allowed to do whatever, even if you are okay with your partner going away. Like you should be okay with also going away, whether to the gym or to your friend's house or whomever, you know, or going on a solo trip.
Yeah. Or you should be okay with sitting at home and just doing nothing. Nothing. Just hanging out. And hey, they come home. Hey, how was it? It was great. Oh, cool. Awesome.
But a mindful nothing also, where it's not just I'm doing nothing, I hate this, and all these things. More like I'm here with myself, with my body, I'm going to cook, I'm going to do whatever.
Yeah. Like for me, it's watching documentaries. Like I'll sit there and watch. I just saw the American Gladiators documentary. If you haven't seen it, I grew up on American Gladiators and there was so much going on. It kind of crushed the child Adrian but to understand what was going on in the background. But something as simple as that.
Yeah.
It's just diving in and doing something that you wouldn't otherwise do with your partner. So,
yeah.
So what's your purpose in life, Paola? This is a very super easy question to ask you.
It's a little deep.
Yeah. What do you think your purpose is in life?
I would say to speak, to build community, and to provide, whether it be services or friendship or just love. I feel like that is what I was put on this earth to do.
Why do you shake your head like that?
Because when we say like, oh, what were you put? You know, it's just like a thing. Like, oh, what's your purpose of like, why were you put here on this earth?
Yeah.
You know? But really, my mom brought me here. Not that I was just put here by aliens, but
well, you never know. You never know.
I feel like that is my purpose of being a provider, be of service mostly, be in a way like God's service worker.
That's awesome. Yeah, I think service is something that's so overlooked, right? And it's something I've made a post or two about it, but just telling people, hey, if you're really depressed and you're down and you're so inward on yourself, go outward, serve somebody else, volunteer somewhere, do something for someone else. See how that changes your perspective a little bit. Because it helped me a lot. I mean, when I worked with the homeless at Camilla's house, like there were down days for me, but then all of a sudden, no, it's not like, oh, look down and feel better about myself. No, but it was like, wow, like I have to be a little bit great. There has to be some gratitude here for what I have and my ability to help these people. And that's where I found the sense of purpose also, you know, like, okay, I have the ability to help others. It's huge.
Yeah.
It's huge.
I have literally the ability, like I'm mobile.
Yeah. Yeah, exactly.
To do this while others may not. And I started my psychology experience at Nicholas Children's Hospital as a volunteer in the psych unit where we see all these severe cases. And And I feel like that's one of the moments where it really clicked, where I was like, I need to be of service to the people, to the community, just to the human race. Yeah. And gratitude is like one of our biggest healers, right? Like, what do we have that we feel like we're lacking in when we may not be? That scarcity mindset, right? And so gratitude almost heals that and patches that up and puts a Band-Aid over the things that we think that we're lacking when we're not. And not in a comparison sense either, where it's like, oh, that person, not like that. It's more just acceptance and love.
But how do you teach gratitude?
I don't know about like teaching gratitude, but it's more like practicing. I guess that's how kind of you teach it. I try to incorporate gratitude into my sessions. Like, at the end mostly. Yeah. What are we grateful for today? Or like, what was your takeaway from today or this week? And just, I think gratitude doesn't always have to be like, I'm grateful for this. It's also just like reflecting. Like, oh, it was a good day because I got to see my friend or whatever, regardless of me getting yelled at by my boss, like it's little things like that. That's in itself, I feel, is also gratitude.
Yeah, something I've always wanted to do, and it's in my mind, is to have so I've been on missions trips to Guatemala, to Haiti, to DR, and different Latin American countries. And something that I always wanted to do is I say adolescent boys, but it could be any youth, and take them to these countries. My daughter's 14 right now. She needs it. Eva, I love you to death. But she's living in a different world right now, right? And she needs to see what that's like, and not just see it from afar, but experience it. Yeah, when I was 21 years old, I went to an orphanage called Nuestros Pequeños Hermanos in DR, and I stayed there for 2 weeks by myself. And I met people from Holland that were volunteering there, from Germany, a kid from New Jersey that was about to go to med school, but he wanted to volunteer there first. He was there for a year. So I met all these very interesting people. There was a Mexican kid that was there too. But man, being there with those kids was something different that definitely had a profound effect on me. And every time I've been on a missions trip, it's had a profound effect on me. And I always have thought, I need to pass this on to other people, because that experience can shape you and change you, and changes. Same thing working with the homeless. When I would teach the students about my work with the homeless, I was changing their perceptions of what homelessness was, and then going out there and showing them, taking students literally to the streets. They were like, oh, I don't look at homeless people the same anymore. People have written to me on Instagram, hey, because of you, this, and this. And I'm like, wow, that's so cool. Because you're changing the way their perspective completely. And so how can I want to take my daughter, because I need her to see. I think it's going to help her with gratitude. It's going to help her with not expecting so much more.
Yeah. Not expecting, and also just connecting. Like, what do we really need? Like, do we need these devices? Do we really need all of these things, right? When people who may not have it are still showing some type of joy.
No, not some type of joy. Extreme amounts of joy, hope. I saw people right after the earthquake in Haiti when I was there, who the next day were saying, oh, thank God. God is good. We're so lucky. We're so grateful for everything that we have. You're living in a metal shack that collapsed. Your son was buried in the rubble, and they're still saying that they're so happy and grateful. They have nothing. And I remember just being in shock, saying, wait, what?
Yeah. It really brings into perspective, like, what we really need to survive or to be a human being.
Yeah. You started off talking about like the collectivist mindset versus like this individualistic thing that we're taught here in the United States. And that was something that I've seen abroad as well, was just we are very selfish and self-centered and individualistic, and we want to be different. And I think we either have to just teach our immediate family members or try to have some sort of cultural shift where we say, hey, care about one another, love each other.
Yeah.
It's going to make you happier and it's going to make the world better. But it sounds like some kumbaya bullshit, right?
Mm-hmm.
It sounds so ridiculous. Like, no, you got to look out for yourself and you got to go get it. Grab the world by the balls and all this nonsense. And it's like, well, like, it almost sounds weak when you tell people, oh, no, love each other, help each other out.
Mm-hmm.
It's
And
weird.
there's some blurred lines because we're saying be an individual, be who you are, outside of your relationships and stuff. But that doesn't also mean like completely just step away from that. You can provide love in a non-enmeshed way,
Yeah.
right? To your family members, to your relationships, to your friendships. And so most of underserving communities are super collectivistic because what do they have if not each other?
That was it. That's exactly what it is. And I've seen it in Cuba and Haiti and Guatemala. Every place that I've been to has that. You're exactly right. If we don't have anything, at least we have each other.
Yeah. And that, centuries ago, all we did was have each other, right? And we would be nomads and travel to find what we needed, right? Even though we had this community. Mm-hmm. You were going to get the crops. You were going to collect the thing for the fire, and we're all coming together to have this life, to have this meal together, sharing, And so it's like, that's kind of like the perfect dynamic where it's like you are going to go get the fire and that way you're being an individual and that way you're contributing to yourself and all that stuff. But then you're coming right back where you're still part of and integrating to a community.
And here, we don't even know our neighbor.
I know.
I can't even ask for salt. I needed salt the other day. I can't even ask for it. I knock on the neighbor's door. The lady who lives across the street from me has the worst reputation. I hope you're listening.
Oh, no.
I just moved to a new neighborhood. And everybody's like, everybody's awesome except her.
Oh, no.
Okay.
Yeah.
But yeah, no, you're 100% right. Can we change that? Or how can we change it?
By preaching community, and not superficial community, what we were saying, which is like, let's dig deep. Let's find and understand each other in each other, kind of like what I was saying, like I have clients that are mirrors of me, right? In a sense, that's part of my community because I'm like, thank goodness that you brought this to light within your thing, in my mind. So I feel like advocating for the underserved population and being like, we can't have this luxury if we don't also have this, if we don't also help these people, because why do you get to have that and these people don't?
You got to understand, I grew up in a Cuban household and this sounds like communism to them. So this scares them.
Yeah.
It scares people when you say things like this.
Mm-hmm.
When you say, oh no, we have to help those that are less fortunate. Well, what do you mean? And who are we giving our money to? And what entity is that? And what are they actually doing with the money? And are they really helping them? And why don't they help themselves? And they're drug addicts. And the list goes on in terms of the excuses. Because the more that we label, the more we can separate ourselves from them.
That's what I was going to say. A lot of them is judgment.
Because once we judge, our hands are clean and we don't have to deal with them. Oh, he's an alcoholic.
Yeah. Not a human being, just an alcoholic.
Yeah. He's a drug abuser. Who cares?
Yeah. And a lot of people's beliefs, their higher powers, state and promote, giving back and being of service. And so it's like a blurred line there where it's like, oh, well, why would I want to help people who don't help themselves? But it's like, maybe you find parts of yourself within that.
Yeah, it's an interesting thing. Paola, is there anything you feel like? I know we didn't tap into your MMA and your multi kickboxing.
It's more just like
an outlet.
Yeah.
Yeah.
I used to dance, like I mentioned, before my injury, and so MMA and like kickboxing and Muay Thai is very similar in the sense that I'm like working my memory and also physically moving. So that's cool. But I wanted to ask you something.
No, go for it, please.
Yeah. You posted a video recently about how we don't really learn the aspects of business when we're in school. Yeah.
Yep.
And it just so happened that that day that you posted that, I had a colleague who was asking me if I knew like how to do an LLC. What does that mean in taxes? And I was like, oh, I know some information, but I don't really know everything. And so my question is, what have you learned in terms of like creating a business? What have you learned outside of school in terms of creating a business, and how to make it successful and also be able to take care of yourself?
What have I learned? I have learned a lot, Paula. I think it goes back to what we were talking about initially, was stepping out into the unknown and being able to risk failure and put your ego aside. I think that's step one. Because if you don't tell yourself, hey, I'm going to be an entrepreneur, let me see how to do this. If there's any advice I would give to any clinician or any entrepreneur out there, it would be, you have to promote yourself. I mean, forget about the LLC and all. That's all simple things that those are tasks, right? So that doesn't really make the business. The business is, how do I get traffic in the door and how do I get people to trust me?
Right.
Self-disclosure, being visible, being vulnerable. All the things that we've talked about have worked for me from a business perspective. Because if you look back to my Instagram and you scroll up to just before June of 2021, you see nothing but photography. There's no sign of mental health. Yeah, there are long excerpts of things I would write and my philosophical views, but photography. My face wasn't on Instagram. Huge credit to Gary Vee. I started listening to Gary Vee, and as obnoxious as he may be to some people, he really, I really took a hold of what he was saying, because underneath his words and his tone was love and caring and compassion and caring about your employees first.
Yeah.
And really caring about the quality that you're delivering in whatever product or service that you're providing to the community. Yeah. And I related to him so much. And I like the fact that he said fucking shit every once in a while too. So I was like, all right, I can relate to this guy a lot. And so I guess if there's any advice, it's not about LLC, because I'll recommend you to a CPA and to people who can help you with those tasks. But when you're building your business, be vulnerable, be yourself. Make sure the quality of your service that you are providing comes from your heart and has a high quality, because the biggest people who are your marketing team is word of mouth. It's the clients that you serve.
Yeah.
And then beyond that, you have to use social media.
Yep. We're in a technology boom world.
And it's not, this is my company, like over and over. I've seen people just throw promotional ads over and over and over again. People don't care about that. People will delete you. They will mute your stories. If they're your family members, they will just get rid of you. And people will mute and unfollow you even for being yourself as well.
True.
And those are the people that you need to let go. And that's okay. You can't please everyone. Yep. But you will find your tribe. But you have to get past yourself first. And you have to put yourself out there. Because my dad, when he started a tire shop 33 years ago, didn't have social media. And so he's had word of mouth, and he has 33 years to back that little company that's on 103rd Street and 35th Ave. That's my plug. Called 103rd Street Tire Center.
Get your tires here.
Yeah. But so he started this company, and I don't even know how. And I told myself, wait a second. My dad, with no education, barely any money, took a huge risk. 3 kids. Doesn't speak English that well. So he risked everything to start a business that has been open and successful 33 years and has fed me, my brother, my sister, my grandmother, my niece. It's provided me a decent life growing up. And now my brother has taken over, and it's only gotten better. So if he could do it, I can absolutely do it. But the problem is that when we're in school, we're just taught to get a good job. And we're taught about a 401k, and we're taught about benefits. And so it kind of...
It's almost like we're taught to be an employee.
We're taught to... that's my opinion. I think we're taught to be part of the system. Because nowhere... Have you had a course in school about business and professionalism and opening your own practice?
Just an ethics class.
an ethics class,
of how to be a human being,
but nothing
but
about
nothing about
entrepreneurship.
no.
And the reason that probably is because most of the people who are your professors, it's not like they are just part of that system.
Yeah.
So they've never taken that risk on their own, and they don't even see it as an option. But the part that I don't understand is I have volunteered to go and speak at institutions, and they almost don't welcome it. So I'm questioning, why are we being barred? Because it's not only me. There's a lot of clinicians that are running their own successful practice. I've only been open for 3 years, where this has been full time. There are people who have had major clinics, and are offering excellent service and doing groundbreaking things and conducting research. I'm not conducting research right now, but they're really in it for the right reasons, but they're not getting the platform.
Mm-hmm.
They're not able to inspire other people to say, hey, I'm just like you. You can do this too.
Yeah.
And so that's why I'm just putting myself out there and I'm saying it. And actually, before you came, I just told Maria when I was sitting back there preparing all of this, I said to her, hey, we were supposed to have a talk long time ago that we canceled while you were pregnant. I need to do this because I've had 3 or 4 people call me in the past 2 weeks asking for advice, just like you just did. And I want to talk to them.
Yeah.
And I want to just have an open discussion, not about the LLC and should I be an S corp or C corp? And no, that's all garbage. You can pay someone for all of those things.
Mm-hmm. Like you said, they're tasks.
They're tasks, and you will check those boxes, and you will get your licenses. It's nonsense, because you could have all of that and make 0 revenue and have no traction. So I don't know if that answered your question.
Yeah, no, absolutely. It's about promoting yourself as the business, not just promoting the business.
And I think that's very different from what it used to be, because we don't know who the owner of Target is, right?
No idea.
Yeah. But I think now it matters much more on this level.
Yeah.
Like who you are, what you represent, what you're like. I used to think mission and values were garbage, but now I'm seeing, hey, they really matter. Like, because people are watching and reading and going to your website and looking at your social media and saying, well, what does this guy really stand for?
Mm-hmm. Right. Which is, again, that conversation about relatedness. Because it's like, I want to go see somebody that has the same values as me.
Mm-hmm.
And so when we're scrolling, when we're seeing that, we'll unfollow people that it's like, oh, okay, they don't align with our values, but then we'll always seek others that will.
Exactly.
And that in itself is like what you're saying in terms of promoting.
100%. And you're not going to be everybody's cup of tea.
No.
And that's perfectly okay.
Yeah.
It's perfectly okay when you are okay with it.
Yeah.
When you get over the fact that you will be rejected, that you will be criticized, that people will talk about you because you're putting yourself out there.
That could be a whole different therapeutic topic about projection and all of these things.
Oh no, when I have spoken to providers, it ended up being a group therapy session.
I love that.
It ended up being group therapy because the fears started coming up, and the insecurities and the imposter syndrome and the fear of judgment of others. All of these things started surfacing as a result of why they hadn't opened their own practice, why they were hesitant, why they had opened it and never promoted it, and expected people to just fall from the sky. So, I mean, there's a lot of learning lessons. That's a whole nother podcast for another day, but hopefully that answered your question.
Yeah, I did. And in terms of business, we have a bill coming out at the beginning of July that is kind of against the LGBT community. And so in terms of business, do you anticipate any changes in clientele because of this bill and these people who desperately need our help?
Tell me what the bill says, because I'm sorry if I'm being ignorant. I thought you were talking about the DEA bill, regulations, but go ahead.
The bill that providers have the option now to deny care to people in the LGBTQ community.
It's not an option for me.
Well, I meant I've had clients express fear above all, but that they're leaving the state and that they want to leave the state because they, feel fear that the care that they need, especially like transgender individuals, they're not going to be able to receive it here. And so at first I was expecting like an influx of clients who are going to be in need of support and help because this bill is coming on, because there's a lot of controversy around it, and some people are just not nice to these people in the community.
I would tell you this. I would say that anybody who's part of the LGBTQA community, that this is a good thing for you.
In what sense?
Well, it's shedding light. If somebody is now refusing care when they felt like they were forced to give you care before, that's somebody you shouldn't be seeing to begin with, because that person doesn't give a shit about you.
Right.
And they're judging you before you walk in the door.
Yeah.
Look, I'm going to be very, very frank. I don't care about pronouns. I don't care about whatever else that the media uses to divide us, because I feel like a lot of these things are tools that are used to divide us. I don't care if you're red or blue. I don't care if you have a rainbow flag. I care that you're human. And when you sit across from somebody who's transgender, I'm not concerned about, I'm concerned about how can I help that person?
Yeah.
That's it.
Yeah.
But the problem is that not enough people have that experience. Not enough people have sat across from somebody who's transgender and had a conversation. Because if you did, then you would say, this is just a human with problems just like mine.
Yeah.
Because it's not just the gender issue. No, there's things beneath that, just like anybody else.
Anybody.
But then we just want to create this division, and that's where we're at.
Yeah.
That's where we're at in all aspects of society, whether you're Democrat or Republican, whether you are part of the LGBTQA community or not. We're just trying to find ways to divide us. And that's all it is. And everything, life is not black and white. There's so much gray. Yeah. There you go. It's in living color. It's definitely all spectrums of the rainbow.
Yeah.
And a lot of it is gray. So it's just strange. It's very, very strange.
Yeah.
So all in all, I would say,
of course.
That's all I would say.
Yeah.
I would say thank you very much for just pointing out the people who I shouldn't have been seeing to begin with.
Yeah.
That's my opinion.
No, I completely agree. Yeah, it was like when I found out about the bill, I was like, wow, I'm going to expect an influx. But then a client gave me a perspective that they were like, I really want to leave. And I was like, wow, like, are these people going to now miss the opportunity to have care because they're leaving, or they may not have access to health care if they do move, or, you know? And so it kind of just raised concern about mental health in terms of the LGBT community and how they could really be severely affected by this.
Yeah. I have clinicians that are gay. I have clinicians that are trying to conceive. I have good friends of mine who are also clinicians that have an adopted child, and both of them are very successful individuals, and they're amazing parents. Was I taught growing up in the church that this was evil, or this was not the way life was supposed to be? I mean, this is the way life is right now, guys. So you can create whatever rules or laws or pass whatever bills you want, but by you just trying to stigmatize and marginalize these people, you're not doing anything but hurting yourself.
Yeah, you're segregating yourself from the community.
Exactly.
Yeah.
So
I agree. Thank you for that.
Yeah, for sure. Sorry, that was a little...
It was passionate.
Yeah,
I appreciate it.
I didn't realize how passionate I was, but it's true. It's true. I mean, I was brought up in the church, and I always say this: the church taught me a lot of good things, and one of those things was love God, love people, love God, love people, love God, love people, and so that has never left me. It's just don't pick and choose which people to love.
Yeah. Right.
That was always my issue. Don't pick and choose which people to love. Don't be a hypocrite.
Yeah.
At the end of the day, don't be a hypocrite.
Yeah.
Well, thank you so much, Paola, for being here today.
Yes, thank you for having me.
It was an honor and a pleasure. I'm looking forward to... Actually, is there any breath work? Where can somebody find a clinician that works with breath work?
So they're mostly facilitators rather than clinicians.
Okay.
Because anybody could, go out of their way to be like, how do I perfect my own breathing so that then I could teach it to others? But in terms of holotropic breathwork, which is the specific breathwork that I'm talking about in my thesis, it needs to be a certified facilitator. Where I did it is Tapestry of the Heart. It's a retreat center by Monica and Dania, and they are facilitators, which they go to extensive hours of training for this specific type of breathwork. But in terms of diaphragmatic breathing and box breathing, you can find it anywhere.
On YouTube?
On YouTube.
Okay.
Yeah. Even like Google box breathing, and then it'll just give you like a little blurb about like what to do, which is breathe for 4, hold for 4, breathe for 4, hold for 4. So that's the cool part about it. It's easily accessible, except for these type of breathworks that give you altered states of consciousness. But because there's that liability, you always want to make sure to have a facilitator there. And they usually provide sitters so that while you're experiencing and you're under, somebody's there to like provide you with like your needs, whether it be I'm feeling really hot. And so they give you a cold towel, or like the opposite. Sorry.
That's okay. Well, thank you so much for being on.
Thank you.
And I'm looking forward to just seeing your journey as a clinician.
Oh, thanks.
Seeing where this takes you.
Yeah, I hope it takes far.
Right,
well, I know it will, but I hope.
Oh, where can people find you?
Well, I'm working at a private practice right now, Davalos Health Services. But in terms of finding me on Instagram, I have mental health promotion Instagram, Healing Mastered.
So find her at Healing Mastered.
Healing Mastered on Instagram. I'm trying to start a TikTok because I know that's what
I just started.
the kids want. But
I'm trying to be on Instagram, Facebook, TikTok, and LinkedIn. I'm working on being a little bit more consistent across the board. But So again, find Paola at Healing Mastered. And that's all, guys. Thanks a lot. Take care.
Thank you, Doctor.
No, thank you, Doctor.